Earlier this year, the Alabama Supreme Court shocked many when they ruled that in vitro fertilization was illegal. Now, recently, the U.S. Senate failed to pass a bill that would have protected IVF nationwide, and the Southern Baptist Convention voted to denounce IVF. So let's talk about it. Hey everybody, it's Dr. David, board certified pediatrician in Tampa, owner of Holistic Pediatrics and Family Care, and also Dr. David MD, which is the company that puts out these types of videos. And of course, I focus on reproductive choice, all types of medical choice. I believe it's the person's decision, not the government's, to determine what they think is in the right interest for themselves when it comes to different types of medical procedures. Now, of course, choice is something we shouldn't take lightly, but it's something that people should have autonomy over. Now, I do invite you to please subscribe to this channel if you haven't already, and to join us over in Patreon, where you can have access to my medical protocols, my holistic protocols that I typically reserve just for my patients. So check us out over there. Now, what is IVF, or in vitro fertilization? So mature eggs are retrieved from ovaries, then they are fertilized in a laboratory. They're usually about 8 to 14 eggs that are retrieved, and usually about 75% are considered good enough to be used, and then those eggs are fertilized. So if 8 to 14 are typically done, so about 7 to 8 of them will, I guess 6 to 8 of them would typically be used for that in fertilization. Now, that doesn't mean that they're all going to be implanted at the same time, but they are then because sometimes IVF does fail, and so these zygotes are then put aside and to be saved that they can be used in another time, whether the person does have a successful pregnancy and child but wants to do it again down the road, or if because they fails. Now, once these fertilized eggs are formed, in which they're called embryos, then they are placed back into the uterus. Now, sometimes, depending on whether a woman is having natural cycles, it can be done based upon the cycle. But if not, sometimes medications may be needed in order to prime the uterus, to allow the lining of the uterus to grow properly to accept that conception. Now, sometimes it may be done using a surrogate. Right, there could be a surrogate egg, a surrogate sperm that could be used that's placed into a woman's uterus. But also, sometimes there could even be people who adopt a fertilized egg and use that for the implantation, and that all can happen. Now, of course, if that's successful, then the fetus grows and develops in the uterus, and then if all goes right, eventually there will be a birth. Now, why is IVF used in the first place? So there's lots of different reasons why it may be needed, because they can't get pregnant naturally. So there could be damage or blockage to the fallopian tubes. And of course, that's where the egg, when it's released from the ovary, must travel down that tube to get to the uterus in the first place. If it can't get there, it can't implant. There could be ovulation disorders where a person just isn't having regular cycles, not having cycles at all. So there needs to be things done, as I said, medication to simulate that the uterine grows, but there still needs to be an implantation due to and a conception. A woman could have endometriosis, and this is when tissue of the endometrium, that's the lining of the uterus, that it can grow outside of the uterus into the fallopian tubes, into the wall, and deeper into the uterus. And so sometimes it can even go into the ovaries if it's bad. So obviously that can interrupt a successful pregnancy. There could be uterine fibroids, which are tumors, usually benign, in the lining of the uterus, and that can make the uterus not be acceptable. Sometimes it can be so large that a fibroid can be so large that it may not be able to grow in there. Sometimes you need to remove those fibroids as well, but that can be a reason why it's done. There could have also been a previous surgery done to prevent pregnancy, right? Such as if there was a vasectomy done, right? But they want to go through another means, or if the tubes were tied, right? Once the tubes are tied, you can, of course, go through reversal if that's successful, but the uterus itself may be just fine. It's just, again, that passageway may not have been done due to health issues, but because it was surgically taken care of. There could be unexplained infertility, where just everything checks out okay, but the person still doesn't get pregnant. And there could be a genetic disorder as well, where there may be the need to do, pre-implantation testing to check to see. So let's say if there's like a recessive gene, dominant genes mean the person will always get it if one of the parent carries it. But a recessive gene means that if a parent is a carrier, and if each parent is a carrier, that there may be a 1 in 4 chance of that fetus having that genetic mutation, which may make it incompatible with life. Trisomy 13, trisomy 18, lots of other things. And then, but if you can pick a fertilized egg that doesn't have that type of genetic mutation, then it could proceed going forward. Now, in terms of this Alabama ruling that I was talking about originally, so they ruled that the procedure was illegal under the auspices that they said that life begins at conception. That's what the Alabama's, of course, now, and they immediately banned it. And families actually were in a sudden crisis situation. There were some families who were in the process of having that done, or had the eggs stored, or were already ready and maybe started the procedure of those types of hormones, and then all of a sudden the next day they weren't allowed to do it anymore. Sometimes doctors were just too afraid to proceed. They weren't even sure whether they could or not if they'd started the process. So it really impacted a lot of people who were in the process, and of course, demoralizing to couples, to women who were looking at this as a plan. Now, thankfully, the Alabama legislators, and then signed finally by the Alabama governor, although they had multiple failed attempts, they did finally pass a law that would allow IVF in Alabama. So that's good. Now, fast forward to more recently. Now, some senators had put forth a bill this is now on the U.S. Senate, to try to preserve and protect IVF nationwide, so that this would not be a state by state decision. It would be a nationwide allowance. And they really want to just protect it and expand the protection, not just to in vitro fertilization, but there are other types of fertility methods and treatments that are used. And so this had nothing to do with terminating of pregnancies. This had to do with different ways that a couple could have fertility treatments if they were not able to conceive naturally. Now, it's interesting because this was actually a sponsored by Senator Tammy Duckworth, and she was actually the first senator to give birth while serving in office. But also, both of her children, she had them through IVF. And she clearly feels that she would not have been able to have her family if she wasn't allowed to have IVF, which is what made it quite personal for her. Now, so this vote went forth, and the Republicans, they shot it down. They said no, we're not going to. They voted against it. Okay. Now there were two Republicans, Senator Collins and Senator Murkowski, who voted for them. So I do want to acknowledge that they did, but there would end up being not enough votes in order to pass it. Now there was a procedural bill that was done by the Senate leader Schumer, that he actually voted it down, but he did that specifically so that he can bring it up again. So it's not necessarily dead in the Senate, but of course people have to change their minds in order for that to happen, and that doesn't look very likely. Okay, so then also the same exact week, so the Southern Baptist Convention. Okay, this is the second largest denomination of religion in America, second only to the Catholic Church. Now, they passed a resolution in opposition for the use of IVF technology, again due to the because as part of that there could be fertilized eggs, embryos destroyed in the process, whether it's in the implementing. Sometimes it doesn't pass, but also what to do with those stored embryos, and sometimes they do get destroyed, sometimes they get saved. Sometimes the power goes off, and God forbid it. This did happen once, where those zygotes may not actually survive because of power outages. Now, like the Alabama Supreme Court, again, they were ruling this in terms of because of their vote was due to when they believe life begins. Okay, and again, that's certainly a minority opinion in America. Most people do not believe that life begins at conception. Okay, but let's face it, they are a very big part of the base of the Republican Party. And of course, the Republican Party is going to vote the way that they believe that their constituents are going to want them to vote. But that's a big thing. And that's obviously one of the big hangups here. But it is what it is. People have a right to vote. People have a right to do what they think is right. They have a right to advocate for what they want. But the end result is that something that the majority of Americans strongly believe in vitro fertilization, is no longer protected. It's allowed right now, but again, another administration could come along or something that can change things around. That's the reason why many of us wanted it to be codified as a statute in the U.S. law. So what's my take? Again, as somebody who is a strong supporter of reproductive choice, this should be something that's available and protected to anybody who wishes to use in vitro fertilization or other methods of fertilization to help them get pregnant. And again, I completely respect the belief of people, if it's on a religious or philosophical belief that life begins at birth. I respect that. I understand where people who have those beliefs believe that. But of course, other people don't. As somebody who's Jewish, we don't believe that life begins at conception. We believe it's much further along. In fact, we believe it begins with the first breath of life, and that the soul takes 30 days to enter the body. In fact, my mom, who had a baby who only survived a few hours, that baby didn't actually have a traditional Jewish funeral, because it was felt that the soul did not take over that body because it was less than 30 days. Okay, so different religions believe different things, and of course, there are some people who don't believe in religion whatsoever and don't believe religion should dictate any of that. Now, of course, if most people don't believe it, should the minority be allowed to overrule the majority? That's what's happened. And again, my feeling is, if you do not want to participate in IVF, or maybe you just want to retrieve one egg and one fertilization, put it in, and what happens, so that there's not storage, fine. Don't do that. That's totally your choice, and I 1,000,000% respect if that's your decision. But of course, if a couple wants or needs to use IVF to expand their family, that really should be their individual choice, and it really shouldn't be up to the government. It should be up to them and their doctors as to how to proceed. Have a nice day.